Okay, I'm going to go ahead and get started. With you will continue. If you haven't taken the poll, please take a minute to do so on that. Just welcome everybody today. As you can hear, we are recording this session. It will be on our Canvas site. So if you don't wish to be recorded, you could go ahead and leave. Please rename your profile with your name, where you work, and your discipline. It helps us then be able to take attendance. Please put your information in chat too. Once again, this is an interactive community. It helps us if you have your videos on so that we can see who is joining us. We really love that feedback. Today's session is going to be some nice conversations, so please make sure that we just turn our cameras on, but leave ourselves on mute. Case narratives are a great way to solidify the skills that we learn. So if you have not done that, or you're interested in doing a case presentation, please consider doing one and turn it into us. Anytime we're sharing information, please remember to protect our individual privacy. So don't do identifying information, names, last names, places that they work. If you're unsure of anything and have any questions, you can reach out to a hub member. All of our hub members have an asterisk in front of their name. You can find them in chat by that. The key components of an ECHO session, if today is your first one that you're joining, is really to build that community of practice, that sharing of knowledge. So taking what we learned today and sharing it with other people. We have a didactic speaker, and then we do a case presentation and feedback. We'd love to hear in chat one reflection that you have from this session and one thing that you might take from today's session and add to your practice. As always, you can pre-register for the ECHO sessions to receive any materials or get any information. To get a certificate of attendance, we do ask that you fill out the survey questions that get emailed after the session. I'm going to stop for a minute and let Jared or Michelle talk about the CMEs.
I'll take it. Yeah, hi, everybody. So we will be offering CME credit for today's session, and it must be claimed today no later than midnight Mountain Time. And the code for today's session is, I had it here a second ago, it is 342195. And I will also throw it in the chat. Please watch for an email from me this afternoon with instructions on how to claim the credit. And nurse contact hours are also available by completing a survey by tomorrow. And that survey link will be in the same email I will send. So thanks, Janelle.
Yeah. So we always store any of our information, our recordings, PowerPoints, handouts on Canvas. You can also look for past recommendations from the cases that we've shared on our Canvas sites as well. REDCap is the other survey that you will get in regards to a certificate of attendance that we're asking you to fill out. So please always check your spam or junk email folders. Just another thing for a case study, please, if you have an interesting case, a case that you're struggling with, or just want to get some information from your colleagues, please consider sending in a case study about that. I'm really excited today to have Karissa MacDonald share with us. She has just a wealth of information. I think it's going to be really exciting to hear about it. I'm going to give one more plug about our Facebook, Instagram, and Twitter. So social media, we put content on there. And then we will have another new network of our project scope starting again in March 22nd, 2022, not March 22nd, March 2022. So I am going to stop sharing and end the poll, and I am going to turn it over to Karissa.
Thanks so much. I'm happy to be here. I'm obviously nervous to speak. I just wanted to really share my experience. I have two children. that were born during an opiate addiction. I've had my children taken away with DCFS. I've recovered, and now I say I'm a person in long-term recovery, and I'm grateful for that. With my first child, I felt like I was very young. I didn't know anything about resources. I pretty much did what my mom told me to. So going to the doctor, making sure that the baby was okay and things like that. I didn't have any resources for help, therapy, or understanding why I chose the opiates when I knew I had a little human in me. My addiction started from a really young age. My dad was an alcoholic. He was the dad that would talk on the phone and say, I'm going to pick you up, and then we're left outside and my mom has to leave work and get us. There was a lot of trauma, a lot of resentments, and so that fueled my addiction. I wish I would have, even at a young age, I wish that my school was able to learn more about mental health. It's a real gray area when it's children at a young age, kind of seeing like mental health, trying not to get them on medication and doing it the natural way, but maybe asking prompt questions like, how do you feel? What's going on? When this situation happens, how do you go about it? I just wish that there was a way for me to find out before it was too late. By the time I was 16, I was addicted to heroin. And by the time I was 19, I was pregnant. And I literally had a really drunken night, and I didn't remember what had happened. I woke up with a gentleman on top of me, and I had a baby. 6 weeks later, I found out I was pregnant. There's a lot, and that fueled my addiction as well. There's a lot of trauma that I never addressed. I didn't know how to address, and I didn't have the support I needed. With my youngest, fortunately, I had some time in recovery before I had her, before I knew I was pregnant with her. And so I was able to stop using by the time I was 8 weeks pregnant with her about. I had support. I had everything I needed. I was happy, joyous. I was like, I'm going to do this. I'm never going to have my kids again see myself in addiction. Luckily, my first child was 2 when DCFS came in and everything like that. And I just felt defeated. I didn't know how to detox on my own. I didn't have resources to detox. I only had Medicaid, and so I was left to the streets because I couldn't get a clean urine. And so when I had Braxton, I was like, I'm not going to do this again. I'm going to do the right thing. So I set up my own appointment. I meet with my own doctors. I Google who I'm going to go see to get all my tests to see if my baby has a heartbeat. And so I went to a building off of Salt Lake Regional, and I just remember I was explaining to them, because I'm very open. Once I got into recovery, I was very open about my past, about who I was and where I wanted to go in life. And from there, they took blood samples. They took urine, which is normal, but they proceeded to do drug testing on it. And I was taking an ADD medication, and I did provide later on because I never went back there. But she went ahead and put it in the system and started talking about DCFS. And by this time, I'm 18 weeks, and I'm just like, my heart just sunk. I was just like, I feel no matter what I do, I'm going to get judged, and I didn't know how to go about that situation other than running and hiding. So I looked up midwives, and the midwife that I chose was amazing. I told her about my past, and she just held me and she said, I'm so grateful that you've chosen the path that you're on. And she did say, I am going to talk to you about the amphetamine that the lady found in your urine. And that's when I provided my midwife the information she needed. And I discontinued that medication because we did go over what was A, B, C, D on what you should take in pregnancy. And
Natalie, can you hear me?
I can hear you, but I can't hear Karissa.
That's what, okay.
for
Okay, Karissa, are you back?
yeah.
Okay, we lost you. We all lost you for a minute.
Oh, okay. I'm sorry.
No, mid-sentence, we were all there and then it was frozen. So sorry.
I just wish that the midwives were used more. I feel like the midwife was such a peer support to me, understood me, calmed me, supported me, and talked with me instead of about me. It was amazing. So long story short, I had the baby and I've stayed sober since. I truly feel like the people that support you through your journey and don't judge you have been the greatest accomplishment for who I am today. As of today, I work at a nonprofit organization called USARA. It's the Utah Support Advocates for Recovery Awareness. I am part of the ARCHES program. I'm really emotional. My sister's going through kidney failure, but I'm so grateful to be here today to be able to share. And it truly helps me get outside my feelings. But I'm sorry if you can't understand me, just be like, take a breath. But yeah, today I work for USARA and I'm part of the ARCHES program. And the ARCHES program, we go to hospitals, institution, inpatient detoxes. And during COVID, we were doing outreach for the homeless. And this has been the most amazing way to constantly keep me humble. I meet with people withdrawing. I meet with people that are pregnant. I'm part of the Super Ed clinic, and the support they give those women, and for me to be able to be there, it's amazing. One thing you'll find though is they don't know how to get sober. You know, they've never done it before. They've never had to. And to them, they've never had a baby. And this was one of my biggest hardships, was when I was pregnant with my first, I didn't understand what I had inside me. I didn't understand the urgency. I didn't understand that it was a little human, you know? And the guilt and the shame comes in once you have the baby. And that's where I needed the help the most, right? I was diagnosed with postpartum depression and it was left just like that, you know? Make sure you get plenty of sun. Make sure you tell your mom how you're feeling, and just continue to work through it. So I did. And the only way I knew how to work through it was to numb my feelings. And it just went on and on and on until, you know, I couldn't function anymore. And I am blessed to say that I got incarcerated. That saved my life. And I got through a program, I don't know if you're familiar with it, called the CATS. And it was the most amazing support because they started from your childhood, and that's what I needed. I know, you know, we don't have a lot of peer support out there right now, but it's very crucial for us to be able to help them and be in situations that we've been in ourselves, and being able to explain to them, you're not alone. You know, we're willing to help you through this. But the hardest part, I think, of my job is some you can't save. And when we did outreach, there were so many homeless that didn't want help, you know, because that was their culture, that was their family. And it was heartbreaking, you know, because you just want to save everyone, especially when you know how powerful it is to be in recovery and how good it feels to have a life and how good it feels to drive a car with insurance. You know, that was like my biggest, like, I'm legal, you know, pull me over, you know, and it's just little things like that. And I just want everyone to know that they're supported in some way. You know, I don't just talk about addiction. I've been, you know, raped. I've been beaten up by my significant others. I've had protection orders. You know, I've had evictions. I know so much that, you know, I know incarceration. I know what it's like to have a background following you and haunting you. You know, I have so much, and, you know, the person next to me that works with me at Arches has so many other things. They have prison. They don't have their kids anymore. They have a life where they do have to be on parole for years and years and years. And so that's what peer support is about, is if I might not be able to help them, I know somebody who will. So I probably didn't take up the time I needed. But yeah, if you guys have any questions.
So, Karissa, will you talk a little bit about that stigma that you felt and how, as providers, we might be able to help support or do things differently within that?
Oh, yes, of course. Being completely transparent, especially when I get vulnerable. Stigma is a hard thing. And, you know, if you've never been through it and you've never seen it, if you've never dealt with it, it's hard not to judge. We're human, right? And so maybe having that, sympathy for them, you know, empathy, if you can. It's hard enough to say out loud to somebody, especially in a doctor setting, that yes, I have past addiction. And then they start asking you, how much did you used to do? When did you start? And you already have a pit in your stomach because you see it on paper of what you've done to your life, you know? And I just really wish that maybe through it, have a conversation, letting them know, like, you're in a safe place. We're not here to judge you. We're here to support you. Just verbiage, really. It's really, really easy to switch up what kind of drugs did you do, to, I know you've had substance use in the past. Can we talk about what kind you did? You know what I mean? So it's, and that's just an example, you know. Definitely working on how to approach, especially with somebody who we don't know how you know, how much they've gone through, or how much they've processed, or how deep in recovery they are, you know. But I do know from stigma, it hurts. It makes me feel less than. It makes me feel, you know, it just makes me feel different. And I don't like feeling different.
Chris, I have a question for you. Sometimes when I'm out visiting with families and there's a concern that there might be some substance abuse going on, I struggle with the fact that I'm a mandated reporter and
Yeah.
I'm working with young children who are in the home, possibly where there's substance abuse going on, and I don't know how to support or approach that without also saying, you know, if you tell me about this, I'm going to have to mandate, you know,
We
that.
lost you. Oh, I got you. Okay. So that's a great question, because DCFS had told me the same thing. But the way she approached it was different. So maybe sitting down with them, letting them know, you know, this is a hard situation. I can't even begin to, you know, understand what you guys might be going through. Unfortunately, I am a mandated reporter, but I don't want you to get scared because of that, because we can hook you up to services. I would love for you to spit out USARA. You know, we're a nonprofit organization. We literally do one-on-one coaching. We have peers from all walks of life, you know, and just say, you know, is peer support something you might need? And what they are is just people in recovery, and they know what you're going through, or might be able to walk you through how they did it. You know, just letting them know that this isn't the end. You know, we report you and then now you're screwed. You know, let them know that this is just the beginning. We will help you through it. Don't leave them on, I have to report this, I'm so sorry. Leave them on, I have to report this first, but this, and this, all these things I'm going to hand to you, I'm going to tell you about, and I really hope you choose to use them, because then the ball's in their court, you know, and they do have things to think about. They do have people to call. And I'd be more than happy to give you my business cards too. We go to hospitals, detoxes, even I give my cards to people that I see on the streets, you know, that need help. It's very important to get the word out that they're not alone.
Karissa, could you tell a little bit more about USARA and maybe what the acronym is and what areas you serve and what you really do within that?
Yes. So USARA stands for Utah Support Advocates for Recovery Awareness. We have one in Ogden, Salt Lake City, St. George, Price, and Moab. We are the only active arches, though, in Salt Lake. So our resources are pointed towards Salt Lake County. But we don't hesitate to, if they want to, you know, go somewhere else or do anything like that, we will find the resources for them or help them. But a main thing, we don't call for them because we want to walk them through it. We want them to feel like they've done it themselves. And so the big part of USARA is they're all peer support certified. So we all have our CPSS. We all are in recovery as well, including our director.
So I know when people, Chris, I'm going to interrupt you because I know when people do this to me, I always hate it because I can never remember the acronyms, but what is the acronym you just spouted out about?
Oh, okay. So think of it like this, USARA. So it's USARA.
Right. But then you said that you guys all had some kind of certification too.
Yes.
What is that?
So, oh, okay, I get it. It's Certified Peer Support Specialist. I'm so sorry. I'm just used to saying CPSS. Yeah. So
we all are, and we all have our own acronyms. And then somebody thinks, what is that? It means something different in my world. So sorry.
No, you're good. So in order to get a CPSS, you do have to fill out an application. You have to have 2 years of sobriety, and you have to be able to write your story, like a brief bibliography. After that, you're going to get a recommendation from a therapist. And then after that, you're going to get a recommendation from a longtime friend or another CPSS or somebody that can truly say that they know you. And I did my best friend. But after that, you submit the application. They let you know whether or not you've made it. And then you get signed up for a class. It's 40 hours and it's a lot of work. I'm telling you, it is a lot of work. and it's 5 days. You go through a book about this big, but it was the most information that I've ever received in a week of information that should be taught everywhere. It had mental health. It had substance abuse and mental health. It had, you know, just every resource out there. I was just like, oh my gosh, you know, it was so great. And we use the CEUs. We have to do 21 in a year, and then after that or 24 in a year or something, and then after that in a year we renew it, you know, to make sure that we are still understanding our title, what we're doing, stuff like that. So it does expire. You do have to get your recertified, but yeah, I mean, in order to get a certified peer support, you do have to be in recovery. And I think that's huge because, you know, we're talking about children that didn't get a choice, you know, that had opiates in them when they were born or had a taste of them in the womb, you know. That breaks it down. I don't know percentages, but it's going to be a huge risk if they become an addict, you know, and we want to support them and find a way that we can change that stigma and change, not the stigma, but change that pattern, you know.
There's another question in the chat about what is ARCHES.
So ARCHES is, we are underneath USARA. We are part of USARA, but we are, we go to emergency settings. So we go to hospitals, we go to the U, IMC, LDS, Salt Lake Regional, Altaview. We are volunteers at the U. We have our own badges. We do go into the emergency department a lot because we are there every time somebody signs up on Bridge. We are there for peer support. We let them know you are not alone. Suboxone is a great way to start your journey to get off of heroin, but that can't be the only support you have, you know. It's very important in the early stages of the first 30 days, you know, whether or not they're going to have the efforts or actually go through with it and say, I want something different. And, you know, when I had my second child and I had all that support and people constantly telling me I can do it, you know, and you got this, like, simple things, you know, it's just simple things. And I just wish there was more peer support. But we are on call 24 hours a day, 7 days a week. And we are there for anyone.
So, Karissa, I'm Pat. I'm a therapist, and I work in the NICUs at primary and IMC, and I go to LD, and I've had years and years and years of exposure to families who have a child who was prenatally exposed.
Mm-hmm.
And I am a huge advocate for parents. Obviously, I've seen the full spectrum. But I think one of the things that I've often liked to do was to talk about the parents' withdrawal in relation to the baby's withdrawal. And I think sometimes I get reactions that are raw because it's like, oh, you know, my baby is going through what I'm going through. And I don't know if that's helpful.
Yeah.
Is it? I mean, is it because I then say, oh, this is how you can help your baby. This is how you can help some of those symptoms of withdrawal be ameliorated. And what is your reflection on this in terms of yourself and the families you see?
Yeah. So are you talking about the mothers, or are you talking about the mothers that are feeling guilt, shame, especially?
Well, and it's not to emote guilt at all. It's to say, it's to get empathy. It's to say, you're going through your journey, your baby's going through their journey. How can we help each other?
Yeah.
Like,
Yeah.
how can you as a mother help your baby?
Yeah, so I would just say, like, probably the same thing I would tell her, like, hold her baby, support the baby, let her know that it is what it is. It's horrible that, you know, in that moment, it's so horrible. You start thinking crazy, but you can't change the moment. But what you can do is change the perception of the moment. You can hold the baby, love the baby, let the baby know that you're there with her or him, that they're not alone, that you guys are going through this together. And that's the huge thing, skin to skin. Let that baby know, you know, that that baby is not alone, because that baby doesn't know different. I mean, unfortunately, that's horrible to say, but that baby doesn't know what it's going through. All it knows is that mother's there supporting that baby through the pain. That's what I would say.
Karissa, do we have time for another question?
Yeah.
So I'm a nurse who work with the Salt County Health Department Nurse Family Partnership Program. We are a long-term home visiting program with first-time moms. We do have clients with the history like that. And I'm wondering, could you share with us that, you know, the change process has different stages, right? And pre-contemplating, contemplating, and action, all that. And
Yeah.
could you share us with some moments, important like milestones for the turning point to happen, and how you think what are the important things for us home visitors to do to help the clients to reach to that turning point?
Okay, so I would just ask a lot of open-ended questions. That's how I get engaged with my peers. Because I wish I could tell you, like, everyone I see is so happy to see me. A lot of them are not. They're in the hospital from an overdose. They're in the hospital and got life flighted. I had a woman with her, she did a bad shot, a meth, and she got her leg amputated, you know? And the people that we see, it's not always like cut and dry, like she's going to be fixed. I need my backpack, please. You get my backpack? It's in the office because I want to show them something. So I wish everyone was happy to see us, but the open-ended questions, you know, like, what can I do to help support you in your journey? Not yes, no, you know, let them know, say, I'm not here to judge you. I'm here to help you. What can I do to help you? You know, always open-ended questions, because that allows them to really think, you know, and that's what we learned, you know, at CPSS. It's not just yes and no. You want MI. You want to let them have open-ended questions as well as listening to them. So, you know, say, what I heard you say is, what can I do to help you with that turning point? You know what I mean? Let them know that you're having that conversation, because I'll guarantee you, most of them have never heard MI. Most of them have never felt heard. And so when I started USARA and learned that, oh, I was just reading a comment. I'll talk about that in 1 second. Yeah, when I went to the MI meeting, I had never ever felt more heard than I did with somebody just repeating back to me what I said, but in different words. I was just like mind blown. I was like, you heard me. You heard everything I just said. So it's really just, you know, how you want to go about it, open-ended questions, and, you know, MI.
Karissa, to add on to that, that open-ended question, how do we also help support the families or the moms going through this to understand also then their child's development without causing more stress on that mom that's going through some of that. Does that make sense?
So, are you saying, like, how do you approach the mother, letting them know that?
Yeah, by still honoring their feelings, but helping them also see that now we want to also approach their child's development and help them, like Pat was saying, learn some of the things that their baby's going through, but also then developmental milestones that may be impacted.
Yeah, so there is just being transparent with them. Are you talking about after or during pregnancy that you want to approach them?
Every time, like any of those stages. Those are great things that we always want to talk about. So.
Okay, so what you would do is first find out their history. And then once you find out their history, say, I have an excellent program that I think that you'd be perfect for. Letting them know that it's not a bad thing. It's something that might help their baby in the future. And that we would love to help you in understanding more, and we won't be able to do that without your help. Let her know that without her, there is no Project ECHO. That's why they specifically choose women like you, and you are, and just let them know, like, it's not a bad thing. Not everyone's able to be in this project. Not everyone's able to do what you are doing right now and help the babies, understand what's going on. So let them know that that would be a great idea to, like, let them know that they are perfect for it. So real quick, ARCHES stands for Addiction Recovery Coaching in Healthcare Emergency Settings. And then if you guys want, I'll put the 24-hour number in here. We know a lot about crisis. We deal with it on a daily. Even if, the individual is, wanting help or wanting resources or wanting to start their journey, like you said, pre-contemplation. That's our specialty, is pre-contemplation.
Great. There's a couple of other questions of, can USARA help provide resources to families in recovery with finding houses?
Yeah, so if it's okay, so we have the resources for housing. There's a lot of nonprofits that have been, that I just found yesterday, actually, that are new. So what we would do is, talk over the phone with them or meet up with them, or, come to USARA and set up an appointment. We would go over those resources with them. Let them know that this is how, if they needed help, we could show them how to do it, stuff like that. But mainly housing, it's a crisis. I wish I had the golden ticket, but I don't. Unfortunately, the steps you have to provide, if you are not homeless, you just kind of have to wait. But we do have a lot of resources for affordable housing. I myself am a single mother with 2 kids, and I am in a low income apartment, and that's separate from Section 8, but it is part of HUD. And so it's 30%. So we have lots of resources we can go over with them. It's not like, we'll say, go to Housing Connect, fill out the application. We have, between me, the team, everyone else with USARA, we have so many options,
Great. And then Kyla, you in your chat put that also if a woman is pregnant and not yet a parent, reporting requirements to DCFS has changed. Could you speak to that a little bit? I think that all of our—
Yes, this is super timely to this conversation. So in working with Dr. Schmidt at Super Rad and Dr. Bouchai and a few other people, we actually got a legislative change in 2020. But of course, in the middle of a pandemic, other people had lots of other things on their mind. So historically, reporting requirements were, if you did screen a pregnant woman and found out that they were using any substances, including opiates, you were to mark that in their chart and then report at the time of birth. We actually have now changed it so that if you do screen and can connect them to treatment, and at the time of birth, they are actively in treatment or in recovery, and you do not have a concern about their ability to parent, you do not have to call that into DCFS. It's really trying to incentivize early screening and early connection to treatment as much as possible. Now, if they're actively using and they have other kids in the home, and we have reason to believe that those other kids might be in danger, those are still reported.
Yeah.
But if it's, so especially for like nurse family partnership, these first time moms, like the more we can screen and connect to treatment earlier, we can actually prevent that DCFS call entirely. And I think that's a message. But like listening to your story, I think would have been helpful had the doctor like been able to tell you that, like, these are things that if you're open and honest with me now and we can connect you, that doesn't, it's not an automatic door. Because I think unfortunately the old reporting requirement made it seem like, oh great, if I tell you, like there's no choice, like the end of the road is DCFS no matter what. And so this makes it really more about the parent's ability at the time of birth. So it still allows doctors who are concerned to call in, but if you're not, because we were getting calls, child welfare was getting calls with people who were literally transported from House of Hope or residential drug treatment to have the baby and go back. And why should DCFS show up and just stress you out more? Like you're already doing what you should be doing.
Yeah.
And so we made some changes to make that feel a lot less punitive.
Yeah. I was actually there at Super Rad when they were so joyous about it. They were like, oh my gosh. I know Jasmine Charles was definitely on that. But yeah,
Yep.
that's one of the reasons why I love Super Rad. It's my baby. I'm very protective over it because I have been through the DCFS side. I have been through the recovery side, and I literally want every single female in there to know that they're supported and that I've been where they're at and nobody's judging them. And that's the huge part in getting them to open up. And it's literally up to them. I've worked with individuals that didn't get help until they had the baby, you know, but yet I never gave up on them. I let them know, like, DCFS will be involved. You know, I'm not going to lie to you, but I'm going to let you know I won't leave you. I'm not going to judge you. Unfortunately, this isn't what I hoped for you, you know, but, and then I got her into treatment afterwards. She didn't get her baby right away, but she has her baby now. She completed Valley Phoenix. She's doing amazing. She has her son, and she came to USARA's movie night where we have food, a movie. Anyone can bring their family. We have bean bags, blankets, pillows. You could bring anything, and we put it on a projection screen. And that is why I continue to do what I do.
That is fantastic. Kyla, there's a question about, can you share that information? Oh, it looks like you're responding to that question. Sorry. In chat. And I'm going to pause and just see if anybody else has any other questions to ask Karissa about her story.
USARA is available in Ogden. They don't have, they can, I don't know for sure. They are setting up their arches for McKD. Only 9 to 5.
For super rad kind of stuff, not quite.
And for super rad kind of stuff, that's my boss. And for super rad kind of stuff, they're not yet, but they are getting it set up because Ogden set up during COVID. And so it's been kind of a bumpy road, but it's getting there and it's amazing. They do wellness walks every Friday. They have a great following, and they have a whole business set up where they have one-on-one coaching, male and female, and a safe place for them to go. I do know the number to the Ogden location. If you go on myusara.com and hit locations, hit locations, and Ogden will give you all of the information. where they're located, their phone number, and what's going on the events. They'll have a calendar. I'm so sorry. What is Box Elder County? I'm from here, I swear. But where is Box Elder County?
So Box Elder County, Lisa, you came on mute, so I'll let you answer that.
Box Elder County is north of Ogden, Brigham City, and so it's north of Ogden. Would we be able to call you and get support, or would they have to go down to Ogden?
Of course, no. So this is huge. I feel like COVID was a blessing in disguise because we're able to do this. We're able to be all in one place at once with being far away. And so Ogden is more than happy to do virtual visits. You can do phone intakes. You can do one-on-one coaching through the phone. I mean, video would be better just because showing emotion and eye contact is so much better than just hi, you know, but it is what it is. Whatever the person feels comfortable with is what we will do. They definitely don't have to go anywhere, but I would choose Ogden because it is the closest location. And if they ever decided that they wanted to meet in person, they would have to go to Ogden. But other than that, we support anyone from anywhere. I have participants in Provo, you know, and that's far for me.
Hey, Karissa, is it 801-890-7500? Is that a referral line or?
So that is our line, Salt Lake County.
Mm-hmm.
Yeah. And we answer that 24/7. So this week, Sammy's on call. Next week will be Jareth. The next week will be me. I'm Christmas. Woohoo! But yeah, we are always open because we want everyone to know that, you know, it doesn't matter. I mean, typically, will I be happy if I get a call at 3 a.m.? Probably not. But will it help me and help the other person? Absolutely. Because you never know when somebody needs help.
Thank you. Do you have an email? Could you provide an
Yes,
email?
I'll go ahead and put my email. I did, and I'm so sorry, you guys. I put my first and last name, then my number, then my email, and people were like in between me. And I'm like, okay. So it's going to be my first and last name. ISARA. And you are more than welcome to email me with any questions. If you wanted us to do a USARA presentation, that would be awesome. We have the slides for that. It takes generally about 30 minutes. And yeah, we have a lot to offer.
And then there was also a question about do you have patient handouts that we can keep in our clinic about yours? And if
Yes.
we can get that.
So this is our brochure.
So Karissa, I don't know if you can send me a PDF of that brochure and I could put it up on our Canvas and then all the participants can get that.
Yeah, and just real quick, it explains to you USARA bridging the gap between addiction and recovery. USARA's ARCH's peer recovery coaches are certified professionals who meet an individual in a healthcare setting as a result of an opioid overdose, risking develop opiate disorder and or substance use disorder. What is a recovery coach? What does a recovery coach do? What a recovery coach is not. And that goes on to tell you what we do, what, you know. So it's a lot of information, 24 hours, has our Salt Lake address, as well as our website where all of our information is, including groups, stuff like that, events. So I'll send you one of these. I'll go ahead and scan it through my iPhone and just email it to you.
Perfect. And then I'll just post that up on our Canvas site so all participants can get that.
Yeah.
Other questions that you have, anybody has for Karissa? So while I'm waiting, Karissa, I want to ask you a question about your young children as you were going through that process, if you were connected with early intervention and ways that early intervention could also help support you.
So what is so crazy is that she's 12 now. I got her back when she was 4, a month before she turned 4. But what is so crazy to me is I had her in Las Vegas. My mom put me in a detox by the time she was 10 months old. During that time while I was in detox, my father died. And my mom wouldn't let me go to the funeral because she's like, I'd rather my daughter live. And that just fueled my addiction even more. And she moved me to Utah. So there was nothing from there. You know, I had the baby, I moved. And my mom's like, that's going to fix everything, you know? And it didn't. You know, I had no support. I was in West Jordan all the way. And this was in 2010. Okay. This was before West Jordan was beautiful out there and there was Mountain View Corridor. I was on 56th West and in the middle of nowhere. You know, I got lonely. So I did what I knew best, and that was to numb my feelings. I had so much regret, shame. I had to write my dad's eulogy in my detox room. It was hard. And then my family judged me and said, how dare she not be here at her dad's funeral? And I heard all of it, you know, and it sucks because I just felt like I let a lot of people down. And if I had support, things could have been different, you know?
Did either of your children have to, were they participants in early intervention services for delay or disabilities or?
They were not, but I'll tell you what, my 12-year-old is smarter than me. She is just amazing. She does STEAM, which is the after-school program. She does choir. She plays the viola. She's an amazing, just so amazing. My 3-year-old's right where she should be. She has so much vocabulary. I hate it. She just sounds so grown up. But I would definitely be open. My daughter's 3 years old. So, and it was so early in pregnancy, but I would love to do anything to help support. I have no shame in that. So yeah, so I have a 12-year-old and a 3-year-old. And it's amazing to be able to say I have 4 years sober and I have my own place for the first time. I've never, ever had my own place. I have my own phone bill. You know, I don't have to rely on Walmart getting a phone every other month because somebody steals it, you know? It's the little things, and it's the little things that you could talk about with these individuals.
Thanks so
Good
much.
question. Oh, Debbie Mitchell. Okay.
I just wanted to say thanks so much for sharing your story, Karissa. It's really
Thank you
meaningful.
for listening.
Thank you.
Yeah, I just I'm more emotional than normal. Usually I'd put my big girl pants on and I only cry when I talk about my kids. Because it took a lot of work to make those amends, you know, to allow myself to forgive the things that I did around my daughter after the fact she was born, you know, and during pregnancy. It was really hard, but it was so worth it. For the first time feeling emotions and being able to just sit with them and allow yourself to feel is so huge. It was foreign to me for a long time. And now it's like, once I start crying, I ugly cry. I'm like, I can't stop. I'm just reading the chat.
Okay. While we're waiting to see if anybody has any other questions, I'm going to throw up another poll.
Okay.
So if everybody could take a few minutes to answer those questions. And then I'm also just going to remind everybody that our last session is next Wednesday at 1 o'clock again. We will be hearing from Pat Boyle, who will be talking to us about trauma and the sensory processing, and we'll gain some information from that. So please feel free to unmute yourselves also if you have any other questions for Karissa. But if you do not have any other questions, just if you could take a minute and do the chat, and then that was our case presentation as well today. After you take a chat, the poll, and we have no other questions, you are free to leave the meeting.
Thank you, guys.
Karissa, thank you so much for sharing all that. I don't know if you have read through all that chat. There's some great comments in there.
Thank you, guys. That really helps me. Being vulnerable is hard.
It is. We appreciate it so much. It was great.
Yeah.
And a ton of nice resources that you guys have. It's always.
Oh, yeah. Yeah. Make sure, I'll make sure all you guys get this. I'll send it to Janelle, but it is a lifesaver. And I mean, I wish we had USARA everywhere, but it doesn't have to stop with, you know, the doctor. We have peers, we have so much to offer. There's so much. And just the hard part is we can't save everyone. We're not magical, but we do help persuade. Awesome. Yeah, USARA is a great option. USARA is a great option. And especially if mental health and stuff like that, we have a lot of resources for that. And we constantly have different programs and different treatments, different things that are up and coming. And everything we've put on our resource packet, we've met with. You know, we said, is this a good fit? So that's the cool part.
That is fantastic. Yeah. No, we need to get a little bit better about that continuation of care. I know here in the state of Utah, we always have that struggle with continuation of care, so that they have a baby and it's, you know, it's an automatic qualifier into early intervention. And so making sure that we connect those families with early intervention, just as another support with it. It doesn't necessarily mean that their child is going to have a delay or disability, but another great support for the family and child with that. So
have you guys heard of PATH? I mean, they're not associated with us at all, but they came to talk with us recently, and they their conditions, PATH Behavioral Health, they provide psychiatric services, medication management, struggling children, adolescents, and adults. We remove barriers to help clients overcome mental health challenges. So once you find a participant, we call them participants, but once you find somebody that, you know, is willing to do ECHO and Project Scope, what it is, children ages 3+, they help. And that is something new to me. That is amazing. They start at 3. That is amazing. I wish more people would.
Yeah.
That's a crucial developmental stage. I mean, I have one now. She's very interactive. She wants to color. She wants to know every little thing, what things are called. She wants to know what the cutting board is. You know, she is a very particular human being, and this is where they find out who they are as a person. So I just wish there was a little bit more than that. And I wish I had tons of money to make all of it. But yeah.
Right. We all do. Well, Karissa, thank you again for your time, and everybody for joining us today. I'm going to do another plug for if anybody has a case that wants to share with our team next time, we would love to have hear from you. So please reach out to projectscope@usu.edu. And if not, we will see everybody next Wednesday.
Thank you guys.
Thank you all.
You guys are all awesome.
Thank you.
Thanks for asking questions. It made my brain work.
Thank you.
Bye.
Thank you.